Hello, Happy New Year, and welcome to the Can I Borrow Your Skin podcast. I am your host, Angelique Clemens, and the author of the novel Can I Borrow Your Skin. With New Year's, a lot of people go, New Year, new me. And while that is a great philosophy and approach, a lot of us don't actually do the new you. You usually get about 2 to 3 months, if you're lucky, of going through those plans that you had. And everyone wants to, start eating healthy. This year, I'm going to write my book. This year, I'm going to go to the gym every week, every day. I'm going to reconnect with my family, blah, 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 and all that bullshit. I'm going to tell you, if you really want a new you really want to make this year impactful for you, what you really need to do is stop focusing on the commercials about the gym and dating and eating healthy and getting this meal plan and this thing and all this miraculous shit that's supposed to change your life like that. What you should do is start seeing your IST. And an IST or IST is going to be that person that's going to be there for you. And by IST, I really mean your generalist or your primary care physician, PCP, your therapist, your neurologist, if it's relevant for you, a gynecologist, a dentist, all those doctors whose job it is to make you healthy. And honestly, with the weather changing and climate change and things of that nature, if you feel like you're always stuffed up or your nose is always running, but you don't have a cold, you don't have anything really weighing down on you and doing that, you probably need an allergist. And I'm going to call it an allergist because they are separate than an otolaryngologist. It's just someone who will actually see if you have like a deviated septum. If you snore a lot, you feel stuffed up, you're a mouth breather, go see one of them. Because especially if you played sports when you were younger, a lot of people don't realize they broke their nose and it just didn't heal correctly. So go and see one of those people. I am going to focus on two kinds of doctors today because I feel like they are the most important, especially in the world today. The first one that's often overlooked in the IST category is going to be your dermatologist. 1 in 5 Americans by the age of 70 actually will get skin cancer. Now, that's about 9,500 people a day. Think of that number. No one knows 9,500 people. Um, Most cities have more than 9,500 people and villages and towns and things of that nature. So every day, one person in that village or that's in that city, you're going to, like the city of Detroit where I live, what up, though? We have about 950,000 people. So if you look at the 9,500 people, 100 people a day here in Detroit are diagnosed with the skin cancer, and that's mostly melanoma. Melanoma is the most dangerous kind of skin cancer, but you also have basal cell skin cancers, squamous cell skin cancer. So it's just not melanoma, which everyone thinks every skin cancer is melanoma. It is not. Melanoma is just the most deadly and the one we talk about the most. Now, skin cancer, if it's caught early, it's 99% treatable and people are cancer free at the 5 year interval. Now, that doesn't mean in year 6 they get the cancer back and they're going to die. What that means is, in terms of cancer treatment and cancer survival rates, those are taken every 5 years. And so you'll hear at the 5 year mark, at the 10 year mark, at the 15 year mark, etc. Usually with the treatment of skin cancer, they will excise it or cut it off. And unless the surgeon or dermatologist did not get the entire thing, you are cancer free. And they will check to make sure they got the entire thing, that they went deep enough. They will actually analyze that skin patch. And so, with a lot of skin cancers, if you're good at the 5 year mark, if as they're treated, and that's global 5 year mark, your dermatologist will actually be checking you fairly regularly when you first get this cancer excised. And then at that point, they'll start letting you out further and further and further in terms of that one cancer. I will also say that I actually recently saw my dermatologist and he agreed to do some footage with me. And so I'm actually going to splice in the footage here with my dermatologist, Michael Goldfarb. Hi, so I'm here with one of my IST. This is my dermatologist,
Hello.
Dr. Michael Goldfarb. And I just wanted to get you on here to talk to you a little bit about what's so important about everyone going to the dermatologist.
Well, the dermatologist, obviously, if you have a problem with itch, poison ivy, rash, we're here for you. But when we're talking about people who don't have an acute problem, the reason it is nice to see your dermatologist maybe once a year, so they can look you over looking for possibly early precursor lesions to skin cancer. Because we all know with cancer, whether it's skin or anywhere,
Correct.
Early detection is the key.
Absolutely.
And besides just looking you over for it, especially if you bring in family members, we love to do education and discuss what to look for and what to come back for.
Right.
A few of the points I'd like to make today is a sore that doesn't heal. Even if you think you have a reason for it, like, oh, I cut myself shaving, and I'll say to them, but when did you cut yourself shaving?
Right.
2023.
Oh, God.
Well, then you know it's probably not that.
It's not.
Or a scaly spot that never heals.
Right.
Or,
Lotion
and we
will help
love
everything.
to talk about the A, B, C, D, and E of melanoma. And it's a way, that's our most dangerous skin cancer. A means it's asymmetrical.
So it
B,
doesn't all look the same.
Yeah, exactly. Not a mirror image. B, irregular borders. C is color.
Yeah.
Different shades of brown to black to tan.
Are bad. Mm-hmm.
And then the red, white, and blue means of the color of our flag is bad in them all. Red means inflammation, white is scarring, and blue is deep pigment. D is over 6 millimeters, and E is changing or
So
evolving.
if it starts getting bigger, or if it starts moving in different ways.
And, you know, obviously on the first visit we talk about don't go to tanning beds, use SPF 30 plus, use cover up. And
that's for everybody, even those of us with melanin. We can get skin cancer. Remember Bob Marley?
Bob Marley did ignore the spot on his foot for a long time. He's very busy doing his beautiful music, but he needed to take a moment to see one of us. And we could still have him here to this day.
Right.
And also, so many people go to the dermatologist to look better, whether it be Botox, laser, fillers. But everybody's heard the old proverb, an ounce of prevention is worth a pound of cure. By avoiding the sun, you can do even more than all these things can do for you. It's best not to have the problem than try to fix it.
Absolutely. Thank you so much for your
Thank
time.
you.
I absolutely adore you.
Thank
and
you.
we did this during one of my appointments, by the way. And the other kind of IST that I'm going to talk to today would be a cardiologist. And I'm going to be remiss if I didn't mention to you guys, I'm also an IST. I am a toxicologist. And as a toxicologist, my job is to look at drugs. And so we're looking at pharmaceuticals, looking at drugs that are misused, substances that are misused, not just drugs. We look at some things that are herbals that are misused. And the reason why I'm bringing this up is for cardiovascular risk. And so with a lot of toxicological substances, you need to add a cardiologist to your care team. And the reason why I mention cardiology and toxicology right now is I'm in the state of Michigan. In the state of Michigan, we have recreational marijuana use. And these are all kinds of marijuana and marijuana-like substances. And this is by any way of taking it. So whether you are taking it orally, that would be your edibles, the tinctures, the oils, whether you are doing it by inhalation, you're smoking it, you're using a vape stick, whether you're doing it sublingual. And so a lot of people know about like putting tobacco under your tongue and the people spitting and things, but you can also do marijuana like that. They actually have sublingual patches that you just put under your tongue or between your teeth and your gums, and you take it that way. Your teeth and your lip, and you take it that way. And then you can also take it topically. They have creams and balms now with THC in them that you just rub on an area that has pain, or some people use it on things like their labia. And so you can take it that way too. Regardless of how you take it, you are getting the marijuana's active substances, which are THC or tetrahydrocannabinol, THC for short. And then it's going to break down to even more active substances. And so these are your delta number THCs, which are different than the THC parents. It's actually for tetrahydrocannabinoic acid. And I'm gonna apologize now because I'm a nerd out for just a small bit. I was actually going to bring a sign that said "nerd, nerd" every time I go nerd out, but my husband talked me out of it. So y'all can thank my husband for that. So of the different metabolites, the deltas you have, everyone's heard of Delta 9 because that's what is most common. And that one comes from, you know, traditional smoked weed. And so you have your Delta 9s. But when you start getting into some of the synthetic cannabinoids, things like, or what they call the legal highs, those have different metabolites to them. And for a while, they were so that they can circumvent the laws. I'm going to tell you guys right now, as a toxicologist, toxicology laboratories all over the world can test for all of them. So there is a Delta 6, there's Delta 5, and Delta 5 and Delta 7 are actually the same compound. And a lot of people didn't know that you had a Delta 7 drug being developed in one part of the world, and another part of the world was like, I'm making a Delta 5, but toxicologists are like, these are the exact same thing. They are still being sold as a Delta 5 or a Delta 7, but just so you know, they're the same. So if someone's telling you they got this really cool substance that has both Delta 5 or Delta 7 in it, they're ripping you off. Don't pay double for that. Delta 8 is what comes from hemp products, and a lot of that is out there. And it's still being marketed as a legal high. In a lot of places, Delta 8 is just as illegal as Delta 9. Delta 10 and Delta 11 are now what's coming up on the market now. And those things, again, they don't have the same high as a Delta 9 compound, but they are still out there. I will mention Delta 12. Delta 12 does exist. It's the same thing as THCA. If someone tries to sell you a Delta 12 product, don't buy that bullshit. It does not have any of the psychological effects. It does not get you high. You are wasting your money. As someone who doesn't even do drugs, let me put you on some game. It's bullshit. So the reason why I'm talking about this in particular versus all the other drugs that I have tested and studied over a very long time. Now, see, I've been a toxicologist for 20 years. So over the years that I've been doing this is because THC is an oil. All the metabolites are an oil, and they deposit in oil-friendly environments. So it's gonna deposit in your fat. It's gonna deposit in your body like cholesterol. So you go to your doctor because you're having heart-related issues. They are looking for heart-related issues. They're going to do their basic CBC. They're going to go and they're going to take your blood. They're going to take some urine, and they're going to look at your cholesterol, your LDL and your HDL. Everyone's heard good and bad cholesterol. If you're of a certain age, they've tested your good and bad cholesterol. They're going to look at it. They're going to say, these are normal. You're good. You probably need to lose some weight. Especially if you're not a small person like me, they're going to tell you lose weight. If you are of a healthy weight range, then they're going to say you need a better diet. I told you just a few minutes ago that THC will deposit in your fat. So what happens is you say, okay, I need to get healthier. You start losing weight. You change up your diet. You're probably going to break down some of your fat cells. What that's going to do is release more THC actually into your bloodstream. And for those of you, I'm going to take a small detour here. For those of you who are trying to circumvent a drug test, or if you have taken a drug test because you want to get a certain job and they tell you that you can't smoke while you do this job and you come back, you pop positive. Well, those people don't understand how THC works. In order for any drug, THC as well, to clear your system, it needs what's called 6 half-lives. And the half-life of THC is 6 months. And so to have 6 half-lives of THC is 3 years. So especially if you were a chronic smoker, for all of the THC to leave your body, it takes 3 years. So if you truly stop smoking and they can't find it in your bloodstream and you really want their job and they tell you, no, you tested positive, tell them take a blood test. Urine, it's going to be there for 3 years. Tell them take a blood test. They take a blood test, they won't find it, you're good to go. But be smart enough to actually push for that blood test and explain to them, actually, I haven't been through 6 half-lives because I just stopped smoking 3 months ago or 6 months ago. Push them to do that for you so you can get whatever it is. And there are some actual child custody things that will also take toxicological testing if you have to be off all drugs, including alcohol, including THC, and you come back positive for THC, push for a blood test. Okay, back on to what I was talking about. See, I told you I was going to nerd out, so I'm being honest. Um, THC will deposit in your fat cells. It'll act like cholesterol in your body. So when you start working out, you're going to be releasing more THC into your bloodstream. You are going to have the negative effects of it. So what's going to happen is it's going to clog up your blood vessels, your arteries, and it's going to act like cholesterol there. So it's going to start blocking things and it's going to be really negative effects. And actually, the American Heart Association, I want to get this stat correctly, they actually published a couple years ago, and they've been publishing on this every year. And now they're actually funding studies for this. They have actually been able to prove with a lot of work about the deleterious effects of THC on your heart and showing that there are increase in heart disease. There's been an increase in strokes. There's been an increase in heart failures. And there's also been an increase in strokes due to the increase of the amount of marijuana being consumed by people in the United States. And to get specific stats, we have a 34% increase in heart issues overall. This was published by Stanford University. And then Harvard did their own research study, and they actually got even more specific. And they say that it is actually 25% increase in heart attacks and a 42% increase in strokes. And before people start jumping in my comments trying to tear me apart, saying, but there's benefits to marijuana. Yeah, aware, clearly aware of that. And there are. And a lot of these benefits are things like pain relief. And it is good for you. And this is why it is prescribed medicinally. However, this is outside of the scope of what I'm talking about. And I also want to tell you there's a lot of things that can be beneficial to you, like opiates. Opiates are good for you for pain relief, but those are all taken under the care of a physician. And I'm going to go one more thing about jumping in my comments on some bullshit. It's natural. So is cocaine. Cocaine is a natural product. In fact, cocaine used to be a very popular soft drink. So just because it is natural and just because it has some health benefits does not mean you should not be taking it under the care of an IST. And the IST that I want to speak on right now is a cardiologist. If you are taking marijuana, whether it is recreational, because 24 of the 50 states here in the United States have recreational marijuana, or medicinally, 40 of the 50 states have medicinal marijuana, please, please, please add an IST to your team. If you're doing it recreationally, you have no one looking over you with oversight for that, have your PCP start sending you, whether they send you to a cardiologist or not, at least have them do a CT scan of your cardiovascular system once a year, once every couple years, because the last thing you want to do is have a clot or a clog and it not be detected because your IST didn't know. And I'll give you two really important things I think that you guys should know. Because one of the things everyone comes at me with when I know someone who does recreational marijuana, which I have a lot of friends and family members that do, I always tell them, well, get a cardiologist. And they want to name all these famous people that do a lot of weed. And then I start naming famous people back to them that have done recreational marijuana and have had an issue. And probably one of the ones going through it right now, the hardest is going to be Willie Nelson. First, he started off with pericarditis, which is when the muscle tissues around your heart get inflamed and it creates a problem where they start pushing against the heart and the heart can't beat as efficiently as it should be. And so what that ended up causing in him is he had to have some valve replacement, and he hasn't had a bypass, but he has had to have some cardiovascular surgery. And there's a few other celebrities that have just said they've had heart issues, but they won't be specific. And so when I tell you that it is important to put a cardiologist on your team if you want to consume recreational or medicinal marijuana, all the weeds. Just let's just say all the weeds because it's marijuana, it's hash, it's hashish oil. Like if you're gonna do all the weeds, put an IST on your team that's familiar with the impact of the weeds in your body. I'm asking for that. And one last thing I want to mention before I really wrap up and go into some of the details about your ISTs. Um, is I get really annoyed as a toxicologist when one of the defenses about how great weed is to you and how natural it is about how people say no one has ever overdosed on weed. That is not factual. That is 100% not factual. And I did not bring the stack of papers and the stack of case notes that shows that that is 100% not factual. What I'm actually going to do is shout out one of my mentors and good friends. Her name is Marilyn Huestis, Huetis. And Marilyn is a former uh, person. She used to be the chief toxicologist at the SHAMSHA, which is the Substance Abuse and Health Administration of the federal government. And very, very bright woman, very sweet woman. And she's actually called the marijuana lady because most of her career has been on marijuana, THC, its effect on cognition. She's actually done driving studies to show what impairment looks like. And these are control studies. She's done work with pregnant women and recent mothers when it comes to marijuana and marijuana products. She has testified in cases of marijuana only drug overdoses. And there's several of them. And she was actually one of the people that pushed and now a big proponent of testing for marijuana in death cases. And there are labs all across the country that do that. And because sometimes something would come up as an unknown toxicity case and they would test for everything under the sun and all the novel psychoactive substances, which are like your new fentanyls and your new weeds and your new benzodiazepines, like all the new stuff that keeps coming out of labs in China and Europe and in this former Soviet Union and the bloc over there. And we couldn't figure out what it was. And then I can't remember what toxicologist it was because there was like one who continually started doing it in their casework and everyone started doing it. And they kept finding, oh, this really, really high level of THC. And they started doing rat studies and trials, and they were like, this is a fatal dose. And so, yes, you can overdose on THC. It can kill you. So can water. And the idea that there is a substance out there that cannot kill you is absurd. And so, please, people who want to do all the weeds, do your weeds. Do every single weed you want to do. Do them all. Do all. But don't say that it is not able to be toxic because it is. Don't say, oh, I could do the weeds. They're not going to hurt me because it's natural. It is harmful. And there's a lot of natural substances that are harmful. And let's also acknowledge the fact that, yes, there are benefits to it. Pain relief is one of the big ones, or your body would not have specific cannabinoid receptors. But your body also has specific kappa receptors, which are used and are solely for opiates. Your body produces cannabinoids, your body produces opioids because we evolved to do that so that we wouldn't feel extreme pain. It's one of those things you cut yourself and you look down and you're like, oh, I cut myself. Well, you didn't know because your body is producing pain relieving substances. That is one of the things we are supposed to do to help ourselves move through life. Get an IST. If you are doing marijuana, get yourself a cardiologist. Um, One of the last things I want to mention is the fact that me, myself personally, I have a list of ists. And without my list of its, I would not be sitting here today. I would not be alive. I rely on my ists. Everyone from my generalist to my therapist, my cardiologist, my neurologist, and my dermatologist, and every other thing in between. Having an IST is very, very important for you. It's important for your life. And if you are coming into this new year, you want to be a new you, then you need to have an IST. And I highly, highly recommend that. And there is no good reason why you, at the very least, cannot have a generalist. So establish your care. And honestly, at this point in time in 2026, there is not a valid excuse for not establishing care with an IST. Now, I understand the fear for persons of color. I am a person of color myself. And I understand that fear, and that's something that I will talk about in depth in another episode. But there are great doctors out there. And there is some comfort in saying, find an IS that looks like you. Find an IS that listens. There are reviews out there now for doctors where you can look up their health grade. And in addition to health grade, most health systems actually have rankings for their doctors where their patients will actually write in and talk about the pros and cons of their doctors. Look at those sorts of things. Research your IST. You research what kind of car you're going to buy. Research your IST. Make sure the person who you're going to have on your care team is actually someone that's going to listen to you. Doctors will and do mix Eastern and Western medicine. One of the most common pushbacks for not having a doctor, not going to the doctor, is, oh, I do natural medicine. I do all the weeds because it helps with my pain relief. It helps with my mental state. And I don't want to be on all the pharmaceuticals. Just because you go to a doctor does not mean you have to be on a pharmaceutical. There are doctors that will integrate the natural medicines and the natural remedies that you want into your care plan. If you advocate for yourself and say, I don't want to take a pharmaceutical, I want to do this all natural, they can work with you on that. Now, they may say that natural path isn't going to work for X. And you can say, well, I only want to do natural. Then they'll say, I'm recommending this, but I'll see what I could do for you. And that's how you advocate for yourself. And the last is cost. The last major pushback that a lot of people have for not establishing care with an IST or no longer going to the doctor and just blanket, I can't afford it. Well, what a lot of people need to understand and realize is that health systems are all not for profit. Every single solitary one of them. They are not for profit. Some insurance companies are for profit, but health systems, hospitals are not for profit. Any health system that you have, they have what's called a financial assistance program. And you can pick your hospital ABC, and then put in financial assistance program into your favorite search engine, and it will come up with their phone number, their form, and their email address, usually. And if not all three, at least one or two of the three. And what that does is you fill out that form, you send them an email, they will ask for certain information. And I will tell you, if you have a major health issue, you qualify. Usually, if you're a veteran or you're someone with a disability, you may also automatically qualify. But what they'll do is they'll get some of your health and financial information and they will look at it. And most of the time, there's a certain percentage that they'll forgive, everywhere from 25% up to 100% of your care. And those programs are for 1 to 2 years. Um, and if you have an outstanding bill with them and you qualify for this program, they will forgive those outstanding bills, and then they'll give you that outstanding bills and then a year or 2 years of care. And it has been a lifesaver to friends of mine because I've helped them with this program. There's like, I need this surgery. I can't afford this surgery. I'm going to try to take out a loan. I'm like, go through the financial assistance program. Oh, I owe too much. They're not going to talk to me about helping me. I'm like, it's, they're required to just fill out this paperwork. And then they come to me a month or so later. It's like, I'm scheduled for surgery next week. I'm like, awesome. You got the assistance. And the answer is almost always yes. And a lot of times it's at 100% forgiveness. And what they'll do is they'll give you a letter, and it also goes into, everyone's going electronic now. It goes into the electronic file. So anytime you get a bill, it just automatically goes against your record, and they keep track of it. And you just have to reapply, because if your financial situation changes, then the following years it may not be 100%. It might be 75% or maybe half. But until you are at a financial place where you can truly afford your bills are forgiven. So cost is not an excuse to not have an IST. You wanting to do Eastern versus Western medicine is not a reason to not have an IST. I get trust. I 100% get trust, but research, recommendations are very important when you're choosing your IST. So all of these things go into it. And I will tell you that there are a lot of reasons for me to really promote IST, and it has nothing to do with me being one. Even if you wanted to, you couldn't be under my care. That's not how toxicology works. Um, I have so many personal experiences in my life of loved ones and family members and myself personally that if it wasn't for an IST or a care team of ISTs, people would not be in my life. I would not be sitting here, as I mentioned already. I mean, think about the amount of IST that it needed to cure people during COVID or treat people during COVID. A lot of IST and nurses. I would like to say right now that I am not excluding nurses from the IST category, because even if you had a doctor under their, with that doctor under their care team, with them working alongside of them on that care team are going to be your nurses, your nurse practitioners. It's going to be your CNAs. All these people are included under the IST category that I am saying to you right now. As someone in the healthcare industry and have seen the healthcare industry up close and personal, respect to people who choose a lifestyle and uh, their medicine and a few other professions are a lifestyle. It is not something that clocks out of you when you go home, because everyone knows that you're on this IST care team, and they're gonna call you up. And so I'm including all of those people in this IST. Um, it takes a lot for you to be healthy in this world. And it's great to go to the gym. I go to the gym several times a week. I know I'm not a little human, but I work out several times a week. I actually eat healthy. Um, but after being sick and COVID, I had to take 5 years off of my health journey. But my ISTs are the ones who kept me alive and kept me moving, kept me grooving. Um, and this is why I'm such a strong proponent of the IST. I have so many stories that I can tell, and I can't tell them without the permission of the people that they're about. And since a lot of my friends and family subscribe and follow my podcast, even though it is just technically the first episode, I've been already doing some content and talking to people about it. If you're one of those people where an IST has severely affected your life, kept you alive, helped you in some way, shape, or form, feel free to drop it in the comments. If you have questions for me about IST, I can personally answer some of the tox questions. No, I will not tell you what drug is better than another drug. Every time I tell people to get a cardiologist, I get the drug question. I don't do the weeds. I've never done the weeds. I know nothing about the weeds except what they do to the cardiovascular system. Now, if you want to know how they affect the cardiovascular system, feel free, drop a comment below. But if you want to know what's the best weed, I have no idea. I can't help you with the weeds. Um, that's not my place. One other thing I will say, and I think is hilarious in the IST category, would be dentists. And the reason why I think dentists are left out of the IST category is malinformation. And the reason why the dentist should be in the IST category conversation is one, your teeth are part of who you are. They are bone. And so if you're starting to get ossification of your bone, your dentist will probably see it before a scan will. In addition to that, if you are having circular system problems, your dentist, because you see a dentist in theory every 6 months, they would see that based on the health of your gums before your cardiologist would. There are some cancers that will have effects in your mouth, uh, and your dentist will see that before an oncologist or a generalist who can refer you to an oncologist will see it. Funny thing about a dentist, yes, a dentist can tell if you perform oral sex. They think it's hilarious. They won't tell you that they know. They will also definitely know if you've performed oral sex recently. They are professionals, though. They won't go and joke and laugh about it behind your back while you're still in the office. Another reason why I think a dentist is very important in this conversation is personally, I like having a nice smile, and that's your dentist's job. However, one other thing that they will probably see before anyone else is if there's starting to be a major change in your health. Because most people see their dentist more often than they see anyone else. I personally see my dentist twice a year, but I also see my dermatologist twice a year. All my other doctors are usually once a year. And so my dentist will say, "Hey, I think you got um, something going on with this." And I'll go see someone else because of that. Actually, they don't usually say that, but if they do, then I'll make other appointments. So it's really important that if your dentist says, "Hey, this looks abnormal, you should go look at this with someone else," then go do it. Because that's a dentist's job, is to give you information that you can then take on to your other ISTs. So, in conclusion, make 2026 about getting healthy, being healthy, and the best way to do that is not trying to be a renegade in the gym, is not trying to eat bean sprouts and grass the rest of your life. It's about making connections and being there and having great relationships with your IST. Thank you. This has been Angelique Clemens. Welcome to my comment section. Go down there, subscribe, do all the wonderful clicky things you're supposed to do. I'm still learning. I'll get better with the clicky things. Thank you.